Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we'll debug the buzz and renewed interest in ivermectin.
So, Don, did you hear that my state, Iowa, recently, along with a few others, made ivermectin over the counter?
I did. So talking about ivermectin is right up your alley today, literally. Are you going to be our correspondent on the ground with this episode then?
Only if on the ground means grounded in science, Don. And I'm Steve, the pharmacist, live from the field.
And I'm Don, the pharmacist, ready to dig into the situation around this antiparasitic.
At the right time, too, because purported off label indications seem to be going mighty faster than our CE course catalog for this.
So speaking of CE, this podcast offers continuation credit for pharmacists, pharmacy technicians, prescribers, and nurses.
And just log into your pharmacist letter, pharmacy technician's letter, or prescriber insights account and look for the title of this podcast in the list of available CE courses.
And for purposes of disclosure, none of the speakers have anything to disclose.
Now, before we get into our claims, let's review what ivermectin is first. It's a well established antiparasitic for humans, FDA approved for specific worm infections in people like strongyloidiasis and onchocerciasis.
Yeah, and I'm starting to itch as we talk. As this drug's already under my skin. Do you feel itchy yet, Steve, as well?
I'm getting there.
So, anyways, ivermectin works by disrupting parasite nerve and muscle function, essentially paralyzing them. For us nerds out there, it specifically activates chloride channels in parasite neurons, which then stops them from firing.
Yep. And essentially, the paralyzed parasite can't eat and dies. And I really can't say I have any sympathy, Don.
Poor parasite. Yeah.
And when I used to think of ivermectin, I usually thought about its veterinary uses, like deworming
Mhm.
livestock and other animals typically.
Right.
But since the COVID pandemic, this barnyard mainstay has gone mainstream in humans, gaining online attention for off label uses. And several states, Iowa included, have voted to make this prescription med OTC to expand access, increasing patient interest, right?
Yeah. But speaking of interest, is that based on facts or fads? Is ivermectin a stable treatment or is it just horsing around?
Yay or nay, right? And that's the $1,000,000 question, right? And as clinicians, you likely see renewed interest, and that's what we're here to talk about. Today, we'll worm our way through what's real, what's not, and how to guide patients through all the noise so nothing parasites on your clinical judgment.
All right, folks, let's get to that first claim. Sounds like a blast from the past, but it's a viral claim that still resonates today and might be making an encore. And that claim is ivermectin prevents and cures COVID 19.
So we're jumping all the way back to the early days of the COVID-19 pandemic, an era I'm sure we'd all like to forget. But I
Right.
do remember early lab studies at the time showing ivermectin could inhibit viral replication in test tubes, right?
Yeah. When human formulated supplies were running low due to demand spikes, you know, I, people were even purchasing veterinary ivermectin products.
Yes, which we do not advise due to the safety
Mm.
risks. Just want to
Right.
emphasize that.
Yeah. Thank you for that. So, now those early studies used high ivermectin concentrations, which, did show some effect. But keep in mind, again, this was in test tubes. And we know lab studies don't always translate the benefits in actual humans. And some initial studies had to be retracted due to major flaws.
Yeah, and looking at the Retraction Watch website that actually
Mhm.
tracks papers that were removed due to flaws or other issues, their current running tally for papers with COVID and ivermectin is about 16, which is significant.
Mm, yeah, I agree. Now, we've had many human clinical trials since then. When human studies are pulled together and look at the meta analyses, ivermectin showed no meaningful benefit compared to control groups.
And was that with prevention or treatment here?
That is with both.
Hmm.
Patients didn't have lower rates of infection when taking it as a prophylaxis. And when it came to using ivermectin for treatment, there was no reduction in outcomes and things we truly care about, such as hospitalization rates or even death.
Yeah, those are important outcomes. And something that also worries me here is what you talked about with the high doses needed then.
Mhm.
Since there appears to be no benefits, I'd be worried
Right.
that using high doses might then just increase toxicity risks and nothing else.
Yeah, yeah, exactly. Normal doses ivermectin can cause minor side effects such as diarrhea and dizziness, but also severe skin reactions like Stevens Johnson syndrome or even seizures in rare cases. And keep in mind, these COVID studies use high doses such as zero point 0.4 to 1.2 milligrams per kilogram per day. And to put that in perspective, typical dosing for other indications is usually between zero point 0.1 to zero point 0.2 milligrams per kilogram per day.
Yeah, that's quite the difference. Plus,
Yep.
when I looked up FDA recommendations just now, they haven't
Hmm.
changed their recommendation against using it for COVID because of the lack of evidence and the risks.
Yep. Yep. So that recommendation is still the case, all these years later. So going back to that claim, which is ivermectin prevents and cures COVID-19, the verdict is rumor.
So, a good approach here is if a patient is curious about using ivermectin for COVID-19, note that high quality studies show no benefits, and patients may just experience side effects instead of relief. Plus, we have other options for prevention and treatment that I think about.
Yes. And we have our COVID-19 vaccines and managing cough and cold charts to help compare those options, plus regularly checking CDC guidance for info on evidence based treatments.
Nice. And Don, I hate to bring this up, but while we are
I'm
on the
sure you
topic
don't.
of viruses,
Yeah.
I'm sure audience might be getting patient questions about if ivermectin can be used for antivirus.
Oh, yeah. So, antivirus is something that's on many people's minds based on current outbreaks and news. So, it's important to specify that this is a different virus than COVID. Patients typically get it from exposure to infected mouse droppings and urine. The straight up answer is no. We don't have any strong clinical data right now that ivermectin prevents or treats hantavirus.
So I would say advise against using ivermectin for hantavirus until we have more evidence and stay alert for hantavirus updates from public health authorities. Okay, well, that's enough horsing around on that topic, Don. But let's move into a claim around oncology, which is kind of unique and where the stakes are higher. And the claim is that ivermectin prevents and cures cancer.
Yeah. High stakes indeed, Steve. So we're seeing claims about this more online, and ivermectin is an attractive target since repurposing an existing drug means it's more accessible and considered already safe.
Right, good point. And I'm no oncology expert, so I enlisted the help of one of our specialty consultants, Dr. Leslie Jingo, PharmD BCPS. She's an assistant professor of clinical oncology at University of Pittsburgh School of Pharmacy, and we asked her what the evidence actually shows in oncology. Thank you so much for joining us today, Leslie, to answer this question. And we're hearing that patients with cancer are curious about using ivermectin for treatment and even maybe prevention for cancer. But what's the data behind this? I'd love to get your thoughts.
Right. Well, there's very little human data out there at this point. There is a very small clinical trial that reported prelim data, and that was looking at women who had triple negative breast cancer. And they were also receiving, um, it's an investigational anti PD-1 immune checkpoint inhibitor. It's called balstilimab. And basically, they had 8 patients that they were reporting results for, so not a lot to go on.
Right.
Um, yeah, that study is still recruiting, and as of last month, they have 34 patients enrolled, and this is out of California. So it is something that's going on in the United States, which is sort of promising. Um, but as far as those 8 patients that they reported data for, um, one of them ended up with stable disease, 6 had progression of their disease, and 1 had a partial response. So not really a lot to go on there, but I did find it helpful as far as how should we dose ivermectin? How can we help patients use ivermectin safely? And so the doses that they were using were 30 milligrams, 45 milligrams, or 60 milligrams. And they were doing that once a day on days 1 through 3, and then again days 8 through 10, and then the following week, days 15 through 17. So basically, 3 days every week. Every 21 days is how the cycles went.
And these are in
So
milligrams, correct?
yes,
We're
these
not
are
talking micrograms like usual.
that's right. These are milligrams. So a little bit bigger doses than we're used to seeing with the anti-helmintic dosing.
Mhm. Interesting. So it sounds like the data, we're still trying to figure this out. It's very early in humans and trials
Mhm.
are ongoing. And despite this evidence, I'm sure you've encountered patients with cancer who maybe are curious about ivermectin. How should we go about that if patients are curious? Do we completely steer them away? What advice do you give?
Right. So it's difficult to steer patients away, especially if they've already kind of gotten it in their minds that they want to try ivermectin. Maybe they had a family friend who suggested it based on a cousin or, some family member who tried it and had some success. So it's all very anecdotal. So it's really hard to argue against that for some patients. I will tell you, our patients kind of run the gamut. So sometimes they'll ask, and then we kind of say that there's really limited data. As much as I wish that I could suggest ivermectin as a possibility, um, there's just not much to go on. And some patients are really okay with that. Other patients, you can sort of see them almost shutting down, like they don't want to hear that. They really are hanging on to hope. And so I recently did have a patient like that who has been progressing through everything that we've tried to give her. She has very aggressive adrenal tumor, and she was very curious about wanting to add ivermectin to her current chemotherapy. She felt like it maybe helped a little bit before she started systemic chemotherapy treatment, and so she was curious about wanting to go back to that. So rather than just shutting her down and really taking away that hope that she had, I decided that the best thing to do for her was to meet her in the middle. So, really, to think about the safety of doing that. Because the truth is, even when we tell them that it's not a good idea, patients can easily get these medications, even through like a farm supply store or online.
True.
So they're going to do what they want to do. And so we need to do our due diligence to make sure that if they decide to do it, they at least are doing it as safely as possible.
Yeah, I completely agree. Any tips that you emphasize regarding safety or side effects that they should watch out for, especially with the dosing maybe we mentioned earlier?
Right, right. So the number one thing that I suggest is, making sure that we're double checking for drug interactions. And so that was something that I did for this patient. Fortunately, there aren't too many drug interactions for ivermectin, but it's still always a good idea to check for those. The other important piece is really you want to use a reputable source. So you don't want patients to be going online looking for this because who knows what's in that formulation. Likewise, you don't want patients to go to the veterinary products that are out there. Those are very difficult to dose. A lot of them are topical, so it doesn't make a whole lot of sense translating that to human use. And then I think probably the most important piece is really helping them understand that this isn't something that you're going to take every single day. Because the half life of ivermectin is about 18 hours, it's really important that we don't just continuously take the ivermectin. So I often will say, it's a good idea if you want to try to take it, maybe try 1 to 2 days a week and see how that goes. Maybe every other um, day at the most, but really don't want to take it continuously every single day. And then as far as side effects go, I always warn them about neurotoxicity. So things that can happen with higher doses of ivermectin would be like confusion, decreased level of consciousness. Sometimes muscle weakness can happen. And at the very worst end of things, you can end up with a coma. Um, so I really warn patients to watch for that, especially their family members. I really make sure that the family members are able to watch for that for our patients.
That's great. And I love that we're kind of minimizing risk as best we can given these tricky situations. And I
Right.
really appreciate your input on this. So I'm excited to share this with Don, see what we think, and hopefully we can provide more perspective on that for our audience. So thank you so much.
Thank you. Thanks for having me.
It's really great to have an oncology specialty consultant help us with this. And looking, other lab and animal studies, they suggest ivermectin may affect tumor signaling and cancer cell growth. But like Dr. Jingo said, human data are limited to case reports, and a small trial is still ongoing, not published randomized trials that we can pretty much hang our hat on.
Exactly. And this is tricky, right? Because patients are hearing about this and they may want to try it
Mm,
anyway. But
yeah.
cancer is serious stuff. We're talking potentially life and death decisions here. And using unproven therapies could delay effective treatments or even cause harm. So, when it comes to this claim that ivermectin prevents and cures cancer, the verdict is rumor. The bottom line here is that if it's not proven in humans, it shouldn't replace cancer therapy.
Yeah. This is a good reminder that pharmacy staff should loop in a patient's oncologist when any med, OTC, herbal, or supplement is added to their regimen. You look carefully at interactions and weigh benefits and risks.
Definitely. And at the same time, these conversations aren't always going to be black and white. Some patients may still be interested in trying something like ivermectin. So, our role is to guide them with the best available evidence and keep safety front of mind, right?
Hmm.
And if patients still want to use ivermectin in this case, we can help check things like dosing and interactions.
Yeah, exactly. You can find more guidance on navigating these situations in our supplements during cancer treatment CE course.
Plus, it's always a good time to offer cancer prevention strategies that actually have benefits based on evidence. Check out our lifestyle and cancer risk CE course for practical ways to reduce risk, like cutting
Mm,
back on alcohol, quitting smoking, and obviously using sunscreen.
right. So before we get into our next claim,
If this episode is helping you cut through the noise, here's something to make your professional life a little bit easier.
right, are you a subscriber? Don't forget to claim CE credit for this episode.
And not subscribed yet or thinking about upgrading, access more trusted clinical insights and save 10% with our exclusive listener promo code RVT1026 at checkout.
Right, details and links are in the show notes. Don't miss out. All right, moving on to our next claim. I'm glad you mentioned sunscreen a moment ago, Steve, because let's see if the data on this next claim is only skin deep. Claim is oral ivermectin may improve rosacea. So going back a little bit, rosacea is a chronic inflammatory skin condition where skin, usually on the nose and cheeks, are red, rashy, and possibly with pustules.
Mm.
I'll have our producer put that image so everybody can kind of look how lovely that is. But some patients may also have eye irritation, and rosacea sometimes comes and goes or flares up.
And it's important to say here topical 1% ivermectin is FDA approved for
Yep.
rosacea, right?
Right. Right. And it's considered a first line option for papulopustular rosacea. I think I have these puff guards here, all these peas being flowing around. Now, the audience is probably wondering why an anti-parasitic topical med may work here. There's evidence to say that tiny demodex mites in the skin are associated with more rosacea inflammation. Again, our producer can actually put a lovely picture up for that. And ivermectin can kill demodex mites, decreasing their inflammatory effect.
Yeah. And I think this thing kind of looks cute. It's a little pudgy, right? But
Sure.
I'm not comfortable with it crawling on my face. And I love when these claims are both fascinating and frightening. So it helps stop these microscopic invaders topically. But then
Sure.
I'm wondering, where does oral ivermectin fit in here, Don?
Hmm. Yeah, good question. Well, a handful of small studies suggest oral ivermectin may reduce demodex mite counts and improve symptoms too, but data are limited. We have no data comparing topical to oral regimens to say which one's better.
Plus, we have to acknowledge here that giving ivermectin systemically now exposes the whole body to the
Okay.
drug when we really just need it on the affected areas, like of the face.
Mm.
So, why might patients want to take oral instead of topical then?
Right. So it just may partly come down to convenience. Studies using oral ivermectin for rosacea usually give a dose every 1 to 2 weeks for 2-day doses. And on the other hand, topical ivermectin needs to be applied to the face daily, which can be an inherence issue for some folks. All right, so let's go ahead and go back to that claim, which is oral ivermectin may improve rosacea. The verdict is true with conditions.
Based on that, I would say that if a patient wants to use ivermectin for rosacea, start with topical therapy first since it has more data.
Yeah, I agree. Not all true claims should change practice. Consider oral ivermectin if patients have trouble keeping up with using daily topical ivermectin, or they can't use or afford other approved options, such as topical minocycline, azelaic acid, and others.
And we're just scratching the surface here when it comes to rosacea treatment. You can find more details and product comparisons using our treatments of rosacea chart online. And with that, let's move to our final claim, which is creating buzz in terms of global health. The claim is that ivermectin can reduce malaria transmission.
Yeah, malaria. We don't see that flying around too much here in North America.
True, and it's important to keep it that way, Don. And we should point out this claim is specifically about giving ivermectin broadly to a community to prevent malaria from spreading,
Wow.
not giving it to individual travelers, which we may more encounter in the pharmacy. And also, giving to a community might sound a little bit more counterintuitive. But malaria is caused by Plasmodium protozoa that are transmitted into our blood by infected mosquitoes when they bite us, and some patients may only have flu symptoms after that, such as fever, chills, or headache. But some infections can actually be fatal.
Mm. Yeah, we tend to forget about that since, we really don't see it. And I guess this means you could say that mosquitoes, they are the deadliest animal in the world.
Yeah, I could agree with that. And thankfully, we have prophylaxis meds to prevent it.
Right. I'm sure some of our audience may have patients that come into the pharmacy to get prophylaxis meds like chloroquine or mefloquine before they travel to countries where malaria is a problem, such as in Africa or Asia.
Yeah, and a big problem right now is with malaria that resistance to those meds is growing, and we are slowly running out of options here. So, since ivermectin works against parasites, there is a thought that maybe it could be a prophylaxis alternative at the community scale.
All right. So, my favorite question, to you, Steve, does it have any evidence?
Well, we do have some early study data in humans. For example, one large cluster randomized controlled trial in Kenya that I found was published in 2025, and it compared giving albendazole versus ivermectin doses once monthly for 3 months to a large community. So, again, it's different than the individual patient prevention we're used to seeing.
Benazole, that's an interesting control med to actually give. So, why do they do that?
Yeah, for comparison, that's a good point. So, albendazole doesn't work against malaria, but it does have deworming benefits like ivermectin. So, that helped make a more balanced comparison there. And the researchers found a 26% drop in malaria incidence in the folks who were getting
Hmm,
ivermectin when the entire community was treated.
interesting. So, they saw a decrease. Next question is, what about adverse effects?
Yeah, there were more adverse effects in the ivermectin group, about 6% versus 4%, though. So keep that in mind. And there was no difference in serious adverse events between the two groups, which is important.
Hmm,
Now, other studies looking at this question showed actually no benefit, but they had limitations, such as small sample size and using several antimalarials at once. So it's hard to piece that together. So, when it comes to this claim that ivermectin can reduce malaria transmission, the verdict is true.
So, early studies support that this is true, but only when ivermectin is given to an entire community. It's important to say that it's not for individual prophylaxis yet.
Right. People shouldn't be going over to their pharmacy grabbing OTC ivermectin before they
Mm.
go on a trip. We need more data and recommendations from global health authorities first. And after all, another interesting thing is this study only analyzed data in the kids used in the
Oh.
study. And it was also part of that mass public health campaign in countries where malaria is endemic, not
Mm.
for individual adult travelers from the United States or Canada going to other countries.
That's a good point. And this is a good time to remind folks to refer to CDC's Yellow Book for updated guidance on travel medicine considerations. Plus, you can fly on over to our Managing Common Travel Related Illness CE course for more info. It covers conditions, such as malaria, traveler's diarrhea, and more.
And the bottom line here, folks, is that the
Mm.
evidence matters. And with ivermectin, it really depends on the indication.
Exactly. And in practice, that means avoiding assumptions if we see an ivermectin prescription and ask open ended questions, acknowledge where patients are coming from, and guiding them towards therapies that are actually supported by solid data.
Right, and explain what the evidence does and doesn't show, and then
Mm.
redirect towards safer, proven options when appropriate. And for higher risk situations like cancer, we talked about, make sure to loop in the patient's oncologist before adding anything new, including OTC
Mm.
med supplements or herbals.
If you need extra support navigating these conversations, check out our resources for discussing medical misinformation chart. It's packed with practical tips and links you can use with patients. And continue to trust us with your medication related questions and answers. We'll claim your CE credit and also access our evidence based resources from pharmacist letter, pharmacy technician's letter, or prescriber insights.
And again, if you're not already a subscriber or want to upgrade, you can save 10% with our exclusive listener code RVT1026 at checkout, and there's an easy link in the show notes.
If you're already a subscriber, tap the claim credit link in the show notes or search your CE organizer for this episode. And now, mailbag time. We got an audience question from the last episode about gabapentin. Specifically, they asked us about gabapentin toxicity in pets.
And we're able to reach out to one of our specialty consultants, a veterinary toxicologist, to fetch us the answer about gabapentin here.
So if you're curious, just scroll your feed for the bonus mailbag and you'll find out our full answer there.
And if you'd like to have your ivermectin question about this episode answered for our next bonus mailbag, send us a message.
Email us at truth at trchealthcare.com or send us fan mail right from the podcast show notes. We also use your suggestions and feedback to plan our episodes.
And join us next time where we'll unclog a backlog of claims we are hearing about laxatives.
Can't wait. And Steve, you went there. Let's hope it becomes our number one episode, but it may be a number two episode. Thank you for joining us on Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths.
See you next time.